Okay, so hello to all of you. So I hope that everybody has done well in their exam, and now the exam is over. So now we have to just keep our fingers crossed and hope for the best. And yes, everything will happen very well. Now we will be discussing the anatomy questions, and yes, the questions, they are on the recall basis, the recall which has been told to us. So it is on that basis. So some options may be different, or the question, maybe the language of the question may be different. So feel free to share if you know any other, like if any option is there which you think that it should be this option or that option, or if you want to share something that yes ma'am, this question was asked, so you are free to share, and please give your feedback in that. Now starting with the first question, a very direct question. So in fact, by if you see as a whole, what you will see that direct questions plus clinical integrated questions. As always, it is there, like always it is there, some direct questions are there, and now some clinical integrated questions are there. So we are like working on the clinical integrated questions in the classes also, as well as we have discussed in that 25 important YouTube session also. So now this is a very direct question, and yes, thankfully, this is a question which is repeated every time, and I think everybody would have answered it very correct. When you see, this is the X-ray of the superior view of the foot, and the arrow is on what? Yes, the arrow is on the navicular bone. So very easy, because you can see that when you see the arrow, it is on which side? Yes, it is on the medial side here. And yes, you know, if you talk about cuboid, this is a cuboid, and towards the anterior side, these three are what? These three are cuneiforms. Fine. So I hope that the options were all these. Hopefully the options are all these. So now we have understood that this is the navicular. One more question was there. Now this is a question which was given on the Erb's palsy, and in this the image was given which was very self-explanatory, that it is the policeman tip deformity, and now in the explanation also it was in accordance to that. So the question was that a patient has fell from some height and had a injury towards the shoulder. He is unable to abduct. Okay, he is unable to abduct the arm, as well as unable to flex at the elbow, as well as they have mentioned that there is a sensory loss towards the shoulder side, towards the outer aspect of the arm. Okay, so all these symptoms, they are in coherence to this Erb's palsy, and his limb is in position as shown in the image, which is the waiter's tip deformity. So what nerve roots will be involved in this case? Very well, this is C5 C6. Okay, C5 C6. Okay, so you are saying ki ma'am, in the slightly curved bone. Okay, yes, very correct, Diksha. Okay, so Avinash, you are telling that lateral cuneiform, medial cuneiform were also in the option. So I will include that also in the option. Thank to you. Next question was on the fracture of the humerus, which was towards the shaft of the humerus, and they have mentioned in the question, like there were multiple symptoms which were mentioned in the question, but the students were not able to recall those multiple symptoms. So I have written the question here that a person had a road traffic accident and suffered from multiple injuries. Okay, because we don't know the symptoms, so I have written here multiple injuries, but it was mentioned spiral fracture of the humerus. And if you see in this image, this is the location of the fracture, which is the shaft, and therefore the answer of this question is what? Radial nerve. Image, actually the image of the X-ray was given, and even if the X-ray is not given, then they must have specified that spiral fracture of what? The shaft of the humerus, or towards the middle of the shaft. So was the middle of the shaft mentioned in that? Okay, yes, there was the same image. There was the X-ray of the mid shaft humerus. Fine, that's great. Now coming to the next question. This question we have already discussed in the 25 important YouTube session, and this is the X-ray of the knee joint, in which all these arrows were being put, and the question was that in a road traffic accident, a patient presented with externally rotated leg, and he was observed to have what? Loss of dorsiflexion of the foot. And this is the key point here. Loss of dorsiflexion of foot, you very well know, is what? It is the foot drop. Okay, we are actually talking about foot drop. That means common peroneal nerve. Okay, that means which nerve? Common peroneal nerve. So we have to actually look for what? We have to look for neck of fibula, because a common peroneal nerve, it winds around what? Neck of fibula. So whatever arrow is towards the neck of fibula, so that is the answer. So now let us see towards the arrows. We have to identify that injury can be at which point. So if you see B and C, okay, these both arrows are towards the fibula. So we have to look for the fibula, and when you talk about B, B is towards the head of fibula, and the C is towards the neck of fibula. So therefore the answer here will be this arrow. Okay, so this ABCD is because we don't know that if perfectly it was ABCD in that image also, but yes, the arrows were here. Okay, the arrows were here. So if the arrow is at this point, then we know this is a neck of fibula, which is for the common peroneal nerve which winds around it, and therefore the foot drop or the loss of dorsiflexion is there. So we have already discussed this question when we were doing the 25 important YouTube session. In that we mentioned this same thing, the arrow here, and we said injury at C leads to difficulty in dorsiflexion of the foot, which we mentioned specifically there that C is what? It is the neck of fibula. Now coming to this question, now this question is like I've been given the recall that either the question is this one or the question is this one. So you can just tell me in the comments that if question 5A was there or question 5B was there, you can tell about this. Now, but accordingly, I will discuss whatever may be the question I will discuss. Like the question is, the patient presented with sensory loss of lateral aspect of leg and dorsum of the foot. This was given in the question, but the options are not clear. So if this is given in the option, if they have asked nerve or if they have asked the level of lesion, what is the answer? If they have asked nerve, okay, if they have asked nerve, so we very well know the sensory supply of the foot is what? Towards the dorsum of the foot and lateral aspect of the leg, the nerve is the superficial peroneal nerve. Okay, the nerve is the superficial. Okay, 5A was given, 5B. So few are saying 5A, few are saying 5B. So we will deal with both the questions. According to the question, what will be the answer? If this is given, we know the answer is the superficial peroneal nerve, and the superficial peroneal nerve, because it was not in the options. Okay, it was not in the option. I asked this thing specifically that superficial peroneal nerve, was it in the option or not? So I was told that common peroneal nerve was in the option. So because the superficial peroneal nerve is not in the option and it is a branch of common peroneal nerve, so therefore we will go for A. And if the same thing is given, that the sensory loss, same sensory loss is there, and now if they are asking with the level of lesion, so this is actually the dermatomes. They are talking about the dermatomes. And if I come to the dermatomes of lower limb, just see the dermatome. Lateral aspect of leg. When you say lateral aspect of leg, what is this? Yes, it is the L5, which is also going towards the some part of dorsum also, it is the L5. If you see L4, it is towards the medial side and it is not much going towards the dorsum of foot. Okay, so when you say this lateral aspect of leg and the dorsum of foot, here you can see it is the L5, which is the dermatome of this area, and therefore you can go for answer L5, which is according to the dermatome. If there is any level of lesion, means at the spinal cord level, if there is any lesion or if there is any intervertebral disc prolapse, so the compression or the involvement of L5 spinal nerve can be there, leading to these symptoms, like sensory symptoms towards this aspect. You are saying ki ma'am, both were there, both the questions were there. Okay, options of nerve root question was 5A. Okay, sciatic nerve was in the option. Superficial peroneal nerve, you are saying that it was in the option. As I remember, it was lateral side of thigh. No, it was lateral side of leg. That is, I'm sure, lateral side of leg. And even if the sciatic nerve is given, because they have specifically said lateral aspect of leg and dorsum of foot, so we cannot go for sciatic nerve, because if sciatic nerve is gone, the whole leg area will be gone and the sensory loss will be towards the dorsum of foot also, towards the sole of the foot also. Okay, so therefore the answer will be common peroneal nerve. Fine, that's great. Both the questions were there. Yes, thigh side was mentioned. Okay, you are saying thigh side was mentioned. What I actually got to know that they talked about the action of the thigh. So I will just write here thigh, something related to thigh was also given, and I will look for it, lateral side of thigh. Okay, lateral side of thigh. Fine. Now going to the next question, what structure is located at the level of T4? And when you look at these options here, okay, whenever you are looking at these options, we say the answer is the arch of aorta, and definitely the structure located at level of T4. If you see all the options, options, they are in actually coherence with this constrictions in the esophagus. Cricopharynx, this is a cricopharynx, arch of aorta, left bronchus, diaphragm. We know the cricopharynx or the pharynx begins at C6, then arch of aorta is at the level of T4, left bronchus is T6, and when you say diaphragm, for that we say it is at the level of T10. Okay, you are sure that it was not leg, it was, okay, that's great. I will just go for, I will look for it. Definitely. So when you talk about this question at the level of T4, the answer is arch of aorta. Yes, arch of aorta. Okay. B. You are saying B. Now, what is the presentation of clinical case of Frey syndrome? Okay, this question was there and these options were mentioned. In this, maybe some additional words are there, but I'm sure that one option was having this words sweating and flushing at preauricular region. Okay, and these other symptoms were there, and I've been told anhidrosis, meiosis, exophthalmos. I'm not sure about the D option. Mydriasis was told to me, and anhidrosis. So I'm not sure about option D, but yes, when you are seeing this option, you are very much clear that this is actually for Horner syndrome. The root question was about complete paralysis. Okay. So when we are talking about this symptoms, you can see this is actually for the Horner syndrome. Now we are actually confused between these first two options because the B option is pain due to preauricular nerve. The preauricular nerve is actually greater auricular nerve. That is the same thing. Pain due to greater auricular nerve, or we have to choose this option. So basically we have to choose between A and B, and we will stick with the answer A according to the explanation which is given in the latest edition of the Gray's Anatomy, 42nd edition. And now when you see this, in this, the Frey syndrome, we actually mention auriculotemporal nerve. We very well know it is due to the auriculotemporal nerve injury, and it is written here that it is characterized by what? So Frey syndrome is characterized by sweating, warmth, redness on the face as a result of salivary stimulation in response to smell or the taste of the food. So this is the key symptom here, right? This is a key symptom. If anywhere it is written as pain due to the greater auricular nerve, that may or may not be present, but yes, the key symptom here is this one. So therefore we are sticking to that answer. Yes, A. We are sticking to that answer A. Sweating in the whole face. Okay. One of the options you are saying is sweating. Yes, during eating, sweating. Piyush, you are saying auriculotemporal nerve was mentioned. Can you tell me what was written regarding the auriculotemporal nerve? That what they mention about that? You are saying is sweating of whole face. This was one of the option. Fine. So I have added this as a part of one option while eating. So I've added this point also, while eating, this symptoms are there. Now going to the next question, this was the question which was regarding the great saphenous vein, varicose veins, and the recall is mainly towards this first question, but very few students are also talking about this point. So mainly a lot of students have told me that, man, they have asked us the vein, that which vein is this. So whenever you are seeing this image, you are very much clear it is a varicose vein. What is the side? When you see this image, you are very much clear this is the medial side of the lower limb, and towards the medial side of lower limb. So as we have discussed in the YouTube session also, in the YouTube session 25 important question, we discussed the same thing about the great saphenous vein, and in that we mentioned that towards the whole medial side, the great saphenous vein is there, which is in fact related to saphenous nerve. And in the class also we have mentioned all these points specifically. So when you see the medial side, whatever vein is there, that is what actually this is a great saphenous vein, not the small. So it can be written as So here I will mark the answer. This condition is a varicose vein, and we very well know the answer is a great saphenous vein. Okay, you are saying 8A. Okay, 8A. Okay. Unhygienic auriculotemporal nerve. There was another question, auriculotemporal nerve. That's great to hear. Yes, yes. For this 25 important question, it was there. Now, even if they ask you the nerve, like if they say that this varicose vein is there and during its surgical repair, then a nerve is injured. So, what structure will be injured? So, we very well know that answer is the saphenous nerve. Okay, the answer is the saphenous nerve. This is the structure which is related to great saphenous vein. But I think a lot of students, majority of the students are sticking with the 8A. So, we are also saying 8A question. Great saphenous vein. So, it is a great saphenous vein. Now, when you see this image, this is the embryological question. We discussed this question in the 25 important questions, and we mentioned about this landmark B. We said that which of the marked structure, the nucleus pulposus, the central part of the intervertebral disc, is derived from. So at that point we mentioned the answer is B. And whenever you are talking about the structure, whatever this round structure is here, now that is a notochord, and on the sides we also already mentioned that whatever is mentioned in the sides, this is what it is, the mesoderm, the components of the mesoderm. And in the class, we have already discussed, during the classes, we have already discussed this thing, that whenever the notochord is there, it leads to the formation of neural tube. So finally, the round structure, we know very well, this is the notochord, helping in the formation of this neural tube. So now, when you see this image, exactly the same thing is there. Whenever you are seeing this image, the neural plate is here, this is the notochord, on the sides you have the mesoderm. And slowly the neural tube is formed, and this is actually what is happening here. Neural tube formed here. On the side, this is the same thing, mesoderm. Towards the anterior side, the round structure is notochord. And whenever you are talking about neural tube, so neural tube will help in the formation of what? Spinal cord. Like in the options it is written as spinal cord. So it will be helping in the formation of what? Brain and the spinal cord. When you talk about this mesoderm, we already mentioned that this is a paraxial mesoderm which is actually contributing in the formation of the ribs and the vertebra. And when you talk about the notochord, this is the one which is forming the nucleus pulposus specifically. Annulus fibrosus is the outer component of intervertebral disc. Central component, the nucleus pulposus, is formed by what? It is formed by notochord. So when you see this arrow marked, which was shown here, arrow marked structure, we have understood this is the notochord and the answer is nucleus pulposus. Actually, dear, the saphenous vein was given in the option. In fact, the small saphenous also was given, great saphenous was also given. Yes, nucleus pulposus, intervertebral disc. The same image they marked A, B, C, D and asked notochord will be remnant. Okay, its remnant will be what? Nucleus pulposus. Even if you say that this is marked as A, so it is actually what? This is the notochord and its remnant will be what? Its remnant is nucleus pulposus of intervertebral disc. So this is actually the adult remnant of the notochord. So I will add into this, you are saying, ma'am, they mentioned the word remnant. So if they are mentioning the word remnant, then it is very much clear. Adult remnant, fine. Now going to the next question. Now again in this question, I have been given the recall of two types of question. One question is regarding the facial nerve. Another question was the recall of oculomotor nerve, the third cranial nerve. I was given this question that I will mark it as A and B so that you are able to tell me that which is, according to you, which question is actually asked. So 10A is what? That there is partial closure of the eyelids and there is weakness of the muscles on one side of the face. Fine. So which nerve is affected? So we very well know that it is the facial nerve. Whenever you are talking about the Bell's palsy, one side muscle paralysis, one side muscle weakness plus the inability to close eyes. But Another recall by some other students, they said that ma'am, partial closure of eyelids was mentioned, and specifically this was written that unable to, sorry, not this one, so partial closure of eyelids, he is unable to elevate it, and yes, specifically this was written, the eyeball is turned towards down and out. And we know that whenever it is written as down and out position of eyeball, we very well know it is a third cranial nerve, that is the oculomotor nerve. 10B. Okay, so I'm writing here 10B. So the word which was very specific in that question was down and out, eyeball. And when you read this word down and out eyeball, you know very well that this is what? This is a third nerve which is affected. Congenital ptosis. It was, you're saying it was written congenital ptosis, and history of childhood since from birth. Okay. Since birth. And the keyword here, as I told you, down and out position of the eyeball. That's great to know that 25 important question was very, very helpful. The perforator vein also was given. Okay. In the varicose vein question, you are saying, ma'am, I will add that perforator vein. Now, one more question was there. In that, the keyword of that question was superior orbital fissure syndrome. The patient is found, like they have written this specific word, that superior orbital fissure syndrome was there. So what structure are likely to be affected here? Now, whenever you are talking about the syndrome, you know that superior orbital fissure. What are the structures? What are the cranial nerve which is passing through the superior orbital fissure? We know very well it is 3, 4, 6, and along with that V1, which is the ophthalmic nerve. Okay, which is ophthalmic nerve. So if the superior orbital fissure syndrome is written, means these cranial nerve will be, of course, affected. So the answer here will be A. Okay, so it was mentioned, you are saying, ma'am, it was mentioned that he is unable to elevate when the child tries to look down and out. Okay, okay. He is unable. So when he is trying to look down and out, he is unable to elevate. There was special question on congenital ptosis. That's great to hear that the workbook and 25 important questions, they have been helpful to you. Cranial nerve 4. Right. Okay. So now for this, the question will be A. Now coming to this question, this is this image has been given to you, and when you see this image, we are very much clear about this image that this is the anterior drawer test. Okay. So as I told you that questions have been clearly clinically integrated. So this question was integrated with orthopedics. Whenever you are doing this test, anterior drawer test for assessment of the knee joint, about the assessment of the cruciate ligaments of the knee joint. So we say specifically this test is done to assess the injury of anterior cruciate ligament. So the clinician is performing a test to assess the knee joint as shown in the image, and he holds the upper part of the leg and gently pulls forward. Gently pulls forward. So now whenever we are doing this test, we are trying to assess the injury of anterior cruciate ligament, which actually prevents the anterior dislocation of tibia. So as we have discussed in the classes, when we were discussing the knee joint, we have specifically discussed the function of anterior cruciate ligament, that it prevents the anterior dislocation. So in this test, you actually are testing the injury, and if the anterior cruciate ligament is injured, the movement will be there, like free movement, slight free movement is there towards the anterior side. Whatever movement, थोड़ा सा जो भी movement है वो थोड़ा ज़्यादा होता है. So specifically we say that this test is for what? This test is actually to assess the anterior cruciate ligament injury. Yes, it is anterior cruciate ligament. Now coming to this next question, the question is the person accidentally got injured by a screw in the palmar aspect of the hand, and he presented with pain in the, now the fingers which are mentioned. So this is the keyword here, that what fingers are actually mentioned here, the ring finger and the middle finger. And here the pain is there due to the infection and the pus collection which is present here. The point is that which area can be affected, so that the infection has reached to this ring finger and the middle finger. So for this we say the answer is A, which is mid palmar space. Okay, it is the mid palmar space. Sometimes what happens, like if the infection is in these fingers or the infection is here, so it can go to these fingers, or if we say there is any infection in this sheets of the tendons which are reaching to this finger, then the pus can go to the mid palmar space. So specifically if they are talking about these two fingers, for this only one answer is here, the mid palmar space, which is the option B here. Okay, option B here is the mid palmar space. And if you talk about the other options, I will just zoom it here. One option is mid palmar space, which we have ticked as answer. Another, if it is put here, arrow, this is the thenar space. But for the thenar space, we say that infection is towards the thumb side. Okay, so that is a totally different thing. Then another thing, another option was here. If you see, this is actually representing the hypothenar muscle area or the hypothenar space. And another option was towards the very posterior side. This is actually towards the posterior aspect. We have the dorsal subepineutic space. But we are concerned about the anterior aspect, and we say for these fingers, specifically it is this area which is affected, and it is the, yes, it is the answer will be this arrow. If the arrow has been put here, whatever arrow was there, the answer was that. Okay, the pus was deeper. Yes, in the mid palm, like whenever you say the blood, the whatever pus collection is here, it is slightly in the deeper side. Injury with screwdriver. Injury with screwdriver. Present with pus was mentioned flexion of these two fingers. Okay. Notable to extension. Okay. And as the marking got injured. See, in this, even if this language is slightly different, what is the keyword here is? The keyword here is these two fingers were affected. Okay, there was problem in the ring finger and the middle finger, and this image was there. And whenever this image is there, for this ring and the middle finger, the arrow is this one. It is always this one, which is the mid palmar space. The infection from here can go to the mid palmar space. Now going to the next question. In this question, in a leprosy patient, a thickened nerve was observed in the neck as shown in the image. And if you see the image here, the nerve which is present, the thickened nerve which is present here is this one. And this is specifically which nerve? It is actually the greater auricular nerve. This nerve is greater auricular nerve, or the great auricular nerve, which we discussed that it is supplying the skin of angle of mandible at this location. So whenever we are talking about these nerves here, in the neck, we are having all these nerves, and it is a greater auricular nerve which is traveling in this way, in this direction, going towards the angle of mandible. Also, it is going to supply the ear area. Okay, so in the nerve which is present here is the greater auricular nerve, which is, it becomes thickened. It has been studied in a lot of studies. It has been seen that the greater auricular nerve, it thickens in the leprosy case. Okay. The mid palmar space was the answer. Mention pus deep to. Dear, if it is even if it is written pus deep to flexor digitorum, then also the answer will remain the same, because deep, the mid palmar space is actually present deep to the flexor digitorum tendon. I will write this. They have written in that deep to flexor digitorum. Even then, the answer will remain the same. Yes, yes. Pus was deeper. Okay. Okay, so I think that this question is slightly different question according to you, as you are all are telling that this is a slightly different question. So now we will go to the next question. Next question is, they have given you this image, and this is actually the neuromuscular monitoring which is being done, electromyography you say, and what is done here is that you actually put the electrodes here, which is being done to assess the adequacy of recovery after giving the muscle relaxant. Okay, at the end of the surgery. So during anesthesia, this procedure is usually done, and in the shown image, they have given you this image, and they said that which nerve we are actually assessing here in this. So when you see this image, the answer is ulnar nerve. If you see, the electrodes are put where? The electrodes are put towards the medial side, which is a location for ulnar nerve, as well as They're assessing the thumb. Why they're assessing the thumb? Because ulnar nerve supplies one muscle of the thumb, which is adductor pollicis. So they're actually trying to assess the adductor pollicis. So for this, the answer is ulnar nerve. Okay. You are saying कि slightly different third nerve palsy से कुछ sign option में थे. Okay. Yes, this is a question correlated with the anesthesia, and yes, this question is correlated with ophthalmology, in which it is a clinical integrated question. Visual pathway, whenever we talk about the visual pathway in anatomy, we always mention this clinical aspect which is in the ophthalm. So it is a clinical integrated question with ophthalm, that the patient is having the pituitary adenoma which compress the optic chiasma. What can be the visual defect here? So very well we know that the visual defect will be bitemporal hemianopia. Why is it there? Because the pituitary gland, this pituitary gland is actually closely related to the optic chiasma. And if there is any growth in the pituitary gland, it can compress this optic chiasma. And whenever the compression of this optic chiasma is there, okay, the second structure is representing the optic chiasma. This is the location of the optic chiasma, and whenever we are talking about the second compression at the optic chiasma, so we have this kind of visual defect, that is bitemporal hemianopia. If you say first one, this is for optic nerve, the first represents the optic nerve lesion, okay, which is having the monoocular visual loss, that is only one eye is affected, and the fourth one is showing optic tract. This is for optic tract, in which you actually have homonymous hemianopia. Binasal, okay, it was given binasal also. You are seeing in the options, there was one of the option binasal. Okay, binasal hemianopia means towards this inner side. So yes, definitely the answer will be bitemporal hemianopia. Right. So now we will move on to the next question. There was one of the question. Now this is a question which we say integrated with ENT. Singer underwent thyroid surgery, and after the surgery, the pitch of the voice is disturbed. Now the keyword for this question is pitch of the voice. The pitch of the voice is disturbed, or if we say the loss of timbre of the voice. Okay, even if they use this word, loss of timbre of the voice, or if they say that the pitch of the voice is disturbed. As well as they have mentioned this point that there is an involvement of a tensor muscle, and whenever you are talking about tensor muscle, the tensor muscle of the larynx is cricothyroid. And we very well know that the cricothyroid is supplied by what? Yes, it is supplied by external laryngeal branch, or we say external laryngeal nerve, which is actually a branch of superior laryngeal nerve. So both the points, they are pointing towards, actually they are telling that this is the answer, external laryngeal nerve. Whenever the external laryngeal nerve is gone, the pitch of the voice, or you can say the timbre of the voice, is slightly disturbed. Yes, the singer was not able to sing in high pitch. So the pitch is disturbed, or we say the timbre or voice is disturbed. So in the voice, basically they add the word pitch or timbre. If they add this word, it is the external laryngeal nerve. And as well as the tensor muscle was mentioned. One more question was there. Regarding this nerve injury. A female got choked while eating fish, and the fish bone, it caused injury to the larynx. And now what is the keyword here? That she complained of hoarseness of voice, and very important, the foreign body sensation is there. She feels that something is here. ठीक है, foreign body sensation, ऐसा लगता है कि गले में कुछ फंस रहा है. So what is the nerve which is damaged here? The nerve which is damaged here is internal laryngeal nerve, the internal laryngeal branch of superior laryngeal nerve. And whenever we are talking about the internal laryngeal nerve injury, what happens? The unilateral loss produces, if you read this statement, unilateral loss produces a feeling that something is stuck in the throat, means a foreign body sensation. ऐसा लगता है कि गले में कुछ अटक रहा है, foreign body sensation type की feel होती है. This is a characteristic feature for internal laryngeal nerve injury. Okay, so according to this, According to this, we have understood that this foreign body sensation, and there can be slight hoarseness also, very slight hoarseness may be there. But the main thing is foreign body sensation is there, something struck here, it looks like struck here. So we say the answer is what? It is the internal laryngeal branch. And many students, they also have mentioned me that it was written that the fish bone injury is towards the piriform fossa or the piriform sinus. Even then the answer will remain the same. Okay, even then the answer will remain the same. If they have not mentioned fishbone got struck in piriform sinus, okay, okay, and even if they say piriform sinus, then also we will stick to this answer. The answer will be this, internal laryngeal branch. Okay, loss of sensation from epiglottis to glottis. Fine. So this was a recall regarding the anatomy portion, and thanks to all of you for helping in the options and for telling these points. So whatever points you have told me, I will further add into it in the options also. And I hope that all of you have done really well. And the students who will be now giving exam in the December, so you must have also understood that what type of questions are there. So just be prepared for the injury to where. Options are C7, dense, T12, sacrum. Okay. Intubation in the subglottis. Okay. Liver lobe question was there. Liver lobe. Okay, if you can tell me that which question was there regarding the liver lobe, and if there is any other question, great cardiac vein. The question was there on great cardiac vein. Can you just tell me great cardiac vein, what kind of question was there? Did they mention that which vein is running with this so and so artery, or any other type of question was there? Left side liver, 2, 3, 4. I think yes, this question, I think they asked about related to surgery, integrated with the surgery. I think they asked about the hepatectomy, removal of the liver from the left side, towards the left side. So which segments will be removed? So when you are talking about the left side, we specifically say it is 1 to 4 segment, in which on more left side are second, third and fourth segments. We have studied this in Coniat segment, in the Coniat's classification. Yes. Yeah, left hemi hepatectomy was mentioned, so 2, 3, 4 will be there. Artery image was there. Okay, artery and vein of lung, you are saying. They marked the vein and asked in trachea surgery what vessel will be affected. One question was image of artery and vein of the lung. They marked the veins. Okay. Yes, for that we will be having second, third and fourth segment preferably. Posterior descending artery. Which other structure gets mostly injured by surgeon for great cardiac vein? Okay, okay, okay. Posterior descending artery. So while performing a procedure during the bypass, okay, the posterior descending arteries got injured. I have understood the question. Bronchopulmonary segment resection. The segment resection question was there, which will be the bleeding intersegmental luminal, like that. Okay. Okay. Okay, so thanks to all of you. Now I will be ending the session here. Image 1 shown normal. Normal eye. Second image in below shown light on one eye constriction, both eye, efferent oculomotor, pretectal. Was it on pupillary reflex, light reflex? I think the question was on light reflex according to you. Yeah, you can say pupillary, normal pupillary reflex. If you can just send me again this question, ma'am. One image showed normal eye, second image was showing that shown light, eye constriction is there. Okay, I've got the point. And they're asking about it. that which nerve is there. In this light reflex now we say afferent it is cranial nerve 2 and efferent it is cranial nerve 3. So the answer for this will be cranial nerve 3. One image shown normal eye and second this. So I hope that they were asking about the second eye, that what is happening in the second eye. So afferent is 2, efferent is 3 for that. Okay. For light pupillary reflex it is 3. Oh, Mani Dheeraj. Yes, Hyderabad, from Hyderabad. So I really hope that you have done very well. You have been very bright student throughout. Great. So I will be ending the session here. If there is any other thing which you have to tell, you can just put in the comment box. You can add if you have any options, or if you feel that some other question was asked, you can just tell me regarding that. So bye to all of you and best wishes for your result. Keep your fingers crossed. Hope for the best. Pray to God for the best. And yes, the things will happen very well. And now this is the time to relax a bit and spend time with your near and dear ones. So this is a time when you should sit with your family and spend some time with them and spend some time with your friends also. Okay, so now I'm just ending the session here. Bye to all of you.